My name is Aminata Kamara. I'm the West Africa coordinator of the Tobacco Control Data Initiative, or as we call it, TCDI, funded by the Bill and Melinda Gates Foundation, that aims to fill data and evidence gap to support better design and implementation of tobacco control policies in up to 8 sub-Saharan African countries, including Nigeria.
Hello, my name is Seimbe Ali. I'm the country lead for the Tobacco Control Data Initiative here in Nigeria, and I support the implementation of the project in Nigeria, and I'm based in Abuja. Nigeria has a population of about 202 million people. Nigeria is the most populous country on the African continent, and with a predominantly youthful population, which has about 53% aged 35 and below. About 16,000 Nigerians die of tobacco-related illnesses yearly. In 2012, there was a global adult survey conducted that showed that 4.5 million Nigerians, that is about 5.6% of the population, age 15 and older, were using tobacco products. The Demographic Health Survey of 2018 also showed that there was a prevalence of tobacco consumption about 6% for men and 1% for women aged 15 to 49. Nigeria is made up of 36 states, out of which 5 have their own tobacco control laws in place: Ekiti State, Lagos, Kaduna, Anambra, and Cross River states. There has been awareness and enforcement levels at the national level, but we often see that this doesn't trickle down to the grassroots level, and the extent to which reduction and awareness of tobacco spread is enforced is low at state level. So many stakeholders have emphasized the critical role of activities at state level through law enforcement and awareness raising in their communities. Some states have already been at the forefront of this, such as Ekiti State, which is one of the states that had enacted smoke-free laws before the national bill was passed. The national tobacco control law and state law can coexist and be enforced simultaneously, but where there is conflict, the national law will take precedence. As we started our assessment mission in Nigeria, we spoke to 26 stakeholders from 20 organizations within the tobacco control space in Nigeria to give us a background and understanding what the priorities and data needs are. The interviews that we conducted were with government agencies, civil society organizations, both at the national and state level, members of the academia, a tax policy expert, and a member of the international body. All of these interviews were conducted virtually due to the COVID restrictions in place in the country.
One of the questions we asked was, what do you believe is the top priority for tobacco control in Nigeria? And among the main priority mentioned, the first is implementation and enforcement of existing laws. In Nigeria, a number of factors contribute to inadequate enforcement of the Tobacco Control Act, including lack of resources and the requirement that all regulation must be approved by the legislature before implementation. The second priority is to address the issues of shisha and its widespread use among youth. The third one is related to funding. Respondent mentioned the need to ensure that the government allocates money for the Tobacco Control Fund, which has been approved in the Tobacco Control Act. The first priority is related to industry interference. Nigeria is a prime target for the tobacco industry. One of the reasons is its youth and large population. And finally, illicit trade closes the main priorities. In terms of barriers, the most frequently mentioned were tobacco industry interference, again, lack of political will, and lack of funding.
My name is Deanne Samuels, and I'm the data manager for the TCDI project. We spoke to stakeholders about the data needs that they had, and one of the most commonly reported need was knowing a little bit more about shisha. The use of shisha has increased quite a lot. It's not regulated, and many people don't realize that it actually contains tobacco. So stakeholders wanted to know more about prevalence, how many were using it, who were using. They wanted to know about data on harm, the harm that was associated with smoking shisha, and also learning more about e-cigarettes and other novel products. The second most common theme was in the area of illicit trade. There is no valid measure of illicit trade in Nigeria right now, and therefore the country is forced to use proxy measures. Nigeria has so many porous borders that smuggling of tobacco products is quite easy, and many of the products that are illegally brought into Nigeria are freely sold in the markets. Next were issues surrounding tobacco prevalence. So this means things like regular cigarettes, specifically information by age, by gender, by rural and urban location, and by state. The latest prevalence survey was in 2012, and right now policymakers don't have a lot of up-to-date information upon which to base their policies. They also wanted to have more information about taxes on tobacco products, investments, revenue and generating funds. That was one main area of interest. Another was interference by the tobacco industry, specifically how the industry interferes, through whom they interfere, and the extent of this interference. The cost of tobacco-related harm was another need. This included wanting to know more information about the number of cancer deaths that could be ascribed to tobacco, the full cost of tobacco-related harm, and finally about tobacco agriculture and the value chain, its impact on the economy and how many people were employed, for example. So those were the main needs that were asked about during our interviews.
We have finalized the assessment reports and are currently analyzing the findings to better understand priorities, data needs and gaps, and this will be the starting point for the development of the Nigeria Tobacco Control Data Tool.